Лагуna Honda Hospital is a very old facility in San Francisco, California. It was actually started in the 1850s or so in response to needs that were arising in the gold rush days. When I came there in 1996, the newest part of the building had been built in the 1950s, and it was quite old and out of compliance with current hospital code. Staff were very concerned and wanting to make sure that we could give really good care. And this provided us a real opportunity to really begin to explore new approaches to care. We were very interested in being able to help manage wandering and elopement in a way that was humane, comfortable, not disruptive. And so we were looking at the possibility of using RTLS systems. So in the new facility, we have used both resident locator capabilities so that we can track the location of residents who are at risk for wandering due to dementia. And we've also implemented staff duress. One of the concerns that we had was individuals who have cognitive impairments walking out of doors and getting into dangerous situations. So what we wanted to do was have a multi-stage system of graduated alerts and interventions for that. So we have 4 different levels there. The stage 1 alert was particularly interesting to me. It was really the notion that can we intervene in a way that does not put a burden on the staff, that actually helps that individual learn about the environment in a way that's graceful, not disruptive, and doesn't cause panic for that individual. So the intention here was to have a voice redirection in that individual's primary language. So we worked with AeroScout, which paired with single wire, to put their IP speakers above the door there, so that if a resident is approaching that door, it triggers an alert that says stop, go back, or please step away from the door in the language of that particular individual. So some benefits that we think have occurred from this. First of all, we think that this has been really helpful, the whole environment, including the resident locator system, in improving the comfort of the individuals there, which has resulted in a lower number of transfers to acute psychiatric care. We also think that this has been very helpful in reducing the number of tailgating elopements. Lastly, we think that it's also helped in the staff oversight of the units. We've got private spaces which are really highly beneficial for the individuals, but it makes oversight more difficult, and so being able to use the locator system is very helpful to our nursing staff on that. We're looking to expand the AeroScout RTLS system, first of all by including coverage in our garden spaces. We've got some wonderful grounds, and we really do want our residents to get out and enjoy fresh air and get exercise outside, and yet still be able to trigger alerts if somebody goes out beyond the garden spaces into unsafe territories. We also would like to make use of analytics to examine how is an individual's status changing over time. So for an example, an individual with a traumatic brain injury who is gradually improving in their cognition, if this individual is approaching the door less and less and beginning to respond more and more to the voice intervention, then we know that this person is getting better and that they may be able to return to their home environment for care.